Hello everyone, I'm Sean Walker and welcome to our Wellbeing and Nature podcast, which we've decided to launch this week during Mental Health Awareness Week. So this is our first of 5 podcasts, with the others following every day this week up until Friday. And each day we're going to be focusing on each of the 5 ways to wellbeing. Now, of course, these are connect, be active, take notice, keep learning and giving. And here at Volunteering Matters, we support the work of the Mental Health Foundation, who have launched this week to raise awareness. And you can find more information on their website, mentalhealth.org.uk. It is also an opportunity for people across the UK this week to focus on their mental health, having a sort of check-in. As we know, anything in day-to-day life can affect mental health, external, internal, thoughts, belief, culture, genetics, in some cases. And as we all know, the last year has been hard for all of us. And this week is an opportunity to acknowledge those difficulties, the events, the thoughts and feelings brought on by lockdowns and the pandemic. And it's also an opportunity to connect with one's own mental health. And this year's theme is nature. So the Mental Health Awareness Week website does outline why they have chosen this theme. And in essence, it's because people have been a lot closer to nature this year. They've been going on walks in their local area, exercising outside due to gyms being closed. But also they have conducted their own evidence of the benefits of nature on mental health. And they found that 45% of people reported that being in green spaces had a positive impact on their mental health. But what I find really interesting is that they mention a study that was conducted in the US in the 1960s, and they found that the recovery rate of hospital patients was much faster when the hospital had a view of nature. So in today's episode, we're going to be talking about the first way to well-being, which is connect with others. And this, of course, refers to taking time to talk to others, check in with people. Perhaps during the last year, people have been spending more time going on walks with friends and family and talking things through. Some of the things people have been doing include stuff like visiting people who are shielding, perhaps, and doing Zoom quizzes has also been a popular thing this year. But if there's anything the last year has taught us, is that technology can be a blessing and a curse. Unfortunately, some people become more antisocial using phones and technology. And then there's the other side, which means that more people have managed to stay connected during the last year because we haven't been able to see each other in the flesh. And we did actually conduct our own research here at Volunteering Matters. We asked over 50 people and we asked them how they stayed connected throughout lockdown. And to be honest, it may come as no surprise to you, but 73% said through video calling, 85% chose messaging apps such as WhatsApp, 63% said they kept in touch by meeting outdoors, 85% said over the phone, and then a small 7% stayed in touch using email. So now I'd like to introduce you to James Donnelly, who is the project manager at Volunteering Matters, and also Kyle McFadden, the young engagement manager at Volunteering Matters. So firstly, guys, thank you for coming on.
Very welcome. We're happy to be involved. I know when Jane had reached out, I thought this is something that sounds really, really fantastic that you're doing, Sean. So we're happy to get involved.
No, honestly, it's lovely to have you guys on. So how have you guys been keeping connected during lockdown?
So the unique thing about our project, I guess, is that James and I came on board around kind of early September. So we started our project during the height of COVID, I guess, where we kind of had that awkward period where you can go to shops, but some shops you couldn't go into. You couldn't really go into houses, but maybe one other person you could. So it was quite a creative and interesting time for us to start to get our project together and to build the foundation. So especially with recruitment, with volunteers, that was a common question of, how is this actually going to work? And so that was something that James and I spent a bit of time kind of talking about in our first couple of weeks. So our volunteers starting out were primarily through like channels like WhatsApp or through the phone, and just kind of doing video calls, I guess, whether that was through like WhatsApp video or through platforms like Zoom. And when volunteers were able to, towards the beginning of this year, we allowed outdoor face-to-face meetings, of course, within guidelines and within reason. And, we kind of did healthcare questionnaires and things like that. So that's really how they were able to communicate. And most of our volunteers and our families, I want to say most, with the exception of maybe one or two, all jumped at the opportunity to then be able to meet face-to-face. And of course, that was a bit unique as well, because here you have some volunteers who have already connected with their families and they've built rapport, but it's all kind of been virtually or through the phone. So then you have this other element of them kind of seeing each other for the first time. But I guess there's some positives to that, because from a lot of volunteers, from what we've heard, and the match is going well, when they're able to meet face to face, finally, there's not that kind of awkward period or that awkward transition. They know each other quite well, and it's actually helped, that relationship build to be much stronger. So there's definitely that silver lining in all of this. The way that James and I have really been able to keep in touch with our volunteers, with our families and our partners that we've kind of connected with for family referrals has really all been virtually. We actually haven't had one face-to-face meeting with any partners just yet. We haven't met any families face-to-face just yet. And I actually had my first support and supervision with a volunteer in a coffee shop yesterday. So that was quite fun and refreshing as well. But it's definitely pushed us to be much more creative with our communication and kind of, how we're approaching the different people that we work with as well, and how our communication style is coming across. So I guess it's really helped us for those CV skills. But yeah, I guess that's what I would say overall in a nutshell.
Brilliant. Now, I understand the work you do here at Volunteering Matters is based on parenting skills, reducing isolation and improving the quality of family life. Would you say many of the activities you do in the project take place outdoors?
Yeah, I mean, obviously, as Kyle kind of already started to mention there, we started in the midst of it, which meant that whereas some other projects or some other programs running out there had kind of connections that were already built and then went virtual and then are going back, we kind of started completely virtually, and there wasn't any face-to-face interactions happened until I'd say January, so we're talking a good 5 or 6 months into the project having been set up. In terms of the things that are going on outdoors, it very much has been round about walks in the park, being able to grab a coffee, being part of nature again, getting some, being able to walk more than 5 minutes from your home. And I know that even some of the kind of physical elements that our volunteers have been able to do on a practical level is things like go to the supermarkets with the family, help them choose healthier foods if that's one of the family's action points, help them budget, attend sort of as appointments have started to open up again and as some small community classes and activities have been allowed outdoor basis. A big barrier for the families that we support is sort of anxiety round about attending these things or not having the knowledge of what's available for them. And so having a volunteer to kind of go along with them and introduce them. For me, in my opinion about the virtual support is it fits a need and it's really good, but it doesn't replace in any way what they're able to do now they've started to see each other again.
And I really do completely agree with you there. But of course, now, restrictions are easing, thank goodness. Are you really looking forward to just getting out there and connecting with people face to face again?
Imagine we said no there, eh?
And you just wanted to go back to Zoom.
No, this is the status quo is perfect. Yeah, I think there's so much we've learned. I think in the last year, and there's so much to take away from that and keep. But you're right. Once we start to see, keep referring to it as normality. I'm not sure if that such a thing exists anymore. But once we move back to the way that we see things happen, and it's great to say, well, listen, we've proven that we've went through that. We've been able to kind of maintain or still make a difference to people's lives in the midst of the chaos. And so I think it kind of leaves us in a stronger position to say, well, we can really keep this as such a strong project, and we've got such strong volunteers, and we've got, you know, so much positive that will always kind of be there, where unfortunately other services, I know because of the nature of different services, maybe had to stop entirely. We kind of felt more needed than ever during it.
Well, guys, thank you ever so much for taking the time to talk to us today. It's been really lovely having you both on. But if you guys want to just hang on 2 more minutes, because we have our combined soundtrack of nature. We asked quite a few of our volunteers to record sounds when they were on a walk with nature, record the sound with their phone. We've combined them all together, and it's actually quite surprising the different things that you can actually hear. So take the next 2 minutes, just a time to zone out, relax, and of course we'll be back with the next Way to Wellbeing tomorrow. So in the meantime, take care.